name's Archana. I'm an MD1 student at University of Melbourne in the rural cohort. So about myself, I did the Litero Biomedical Med pathway, which is the guaranteed pathway into med. You have to maintain an average of 70 throughout the 3 years, and if you maintain that, you get a guaranteed spot here. But basically my background is Bachelor of Biomedicine.
And how did that start?
So when I was in year 12, I was looking at applying for undergrad med courses, ideally Monash. And then the year that I graduated was the first year of this course, and I just heard about it on TV. And I realised that I was eligible for the rural eligibility, so I just applied for it, and here we are.
And your friend told me you would have been a dentist, but you had to settle for medicine.
Well, I do have dentists in the family, and including my own sister, so it was always a career path that was, was known to me and very comfortable. And after doing not so well in the UMAT, I was like, dentistry is the way to go. So not needing UMAT for this pathway was actually, in fact, great.
UMAT is crazy. I'm going to talk to Tim later about GAMSAT, so that's another beast as well, but we can have another talk on that. How are you finding med school?
Med school's been really fun so far, but there is a lot of content. I don't necessarily think the content that we do in the first couple of months is it's not that it's necessarily very challenging. It is definitely stimulating, but there is a lot of content when you to cover when you think about like what you've done the last 10 weeks. It all really adds up. But med school's been really fun so far. At the start I was like, foundation, I'm probably not going to be learning much more than what I learnt in biomed, but I feel like you really do take a different approach from biomed to the content. Like, it's much more clinical based, and it's more related to what you need to know as a doctor rather than just biomedical information and knowledge.
So how do you study with the content being so huge and you have to cover that volume in a short amount of time?
So my study techniques, actually I will talk about how it's been changing as well.
Okay.
But I definitely think, so my study technique is to watch the lectures and summarize the lectures. So if it's like a 10-page lecture, I try and aim for like a 1-page summary of every lecture ideally. But
do you ever have like a 10-page lecture?
Pardon? No, we don't have a 10-page lecture, but like ideally I try and summarize the information from all the lectures into what I think is important. And that's how I started. But recently I've started doing Anki. But it really does depend on your technique. I feel like I need to make my own Ankis to get the most out of it because it's tailored to my studies. But in med school I feel like you do not really have the time to make your own Ankis and your own notes for everything. So I think like my technique is changing. I think my plan is to download the MD1 decks, which are available when you start MD in the UMMS resources page, I believe.
Okay.
And add and delete according to your preferences, and just doing what works for you the most, because I think like study is really individualized. Like I really benefit from doing a little summary, because then I know I've watched the entire lecture content and I've seen everything, and I know where my weaknesses and my strengths are. Because by just doing somebody else's Ankis, I feel like I don't have an overall picture of the content. Whereas
kind of sound like you don't actually enjoy the lectures. What do you enjoy in med school? I heard there's a lot of different things that you do.
Well, I think the thing that I enjoy the most is definitely the clinical skills. And even though it's very little on GP placement, there was a day that I got to give 3 IM injections, and it just felt like I did something, and it was really rewarding. Even today we've just gone into the ED to do ECGs, and just being in that hospital environment and seeing real life patients, even demonstrating clinical skills on each other. Like when we first started, I was barely able to find or listen to pulses or do a manual blood pressure, and just being able to achieve that a couple weeks later just feels really satisfying. So That's probably my favourite part of med school, the practical skills.
Tell us about dull movement or dark movement or like whatever.
Yeah, so one embarrassing thing that I've probably done so far was at my GP placement, where I was about to give my first IM injection, and it was a very lovely lady, and I had explained to her, like, you are my first ever IM injection. And the only other injection that I have done was on a sponge in the clinical labs at uni. And the lady was lovely, she was very sweet, and I uncapped the needle, sterilized her arm, and internally I was freaking out a lot. And the needle cap was off. I took it right to her arm, but I could not stick it into her skin. I could not. So I had stopped there, and it was just touching her skin, but I could not push it through for a second. So, and it was just like, it's just a nervousness of your first injection. But honestly, the patient was lovely. We just recapped the needle, took another second, and did it again. So it's just those little things at the start. You're like, oh, I've never ever penetrated through the skin before. I wonder how that's going to be. So it's just been little things that I've done that have been embarrassing.
Pick one of the medical device that you really like and why.
A medical device that I really like?
Yeah.
Probably the stethoscope.
Why?
Why? One, it's a perfect accessory for any look. I feel like as soon as you wear it, it just elevates and you look more like a med student. But other than that, I feel like, well, because we haven't really used that many items so far. We've done the blood pressure cuff and the stethoscope.
And you can't carry the blood pressure cuff around your neck.
Yeah, the blood pressure cuff will not be as aesthetic on. But, so I think the stethoscope so far, because that's what we kind of used a lot.
Does it actually have a use, or do doctors just have it to show off?
No, I feel like definitely, at least my GP has been using it on almost every single patient that comes in. So yeah, so far I think I would go to stethoscope. Are you going to count like the syringes and stuff as instruments?
Yeah, you can count them, the medical devices. Like, what are you going to do with them? Like, stick them on somebody?
In that case, I think it would be...
You on the camera, don't say you love needles, please.
No, it's just... I feel like I get the most out of, like, when I'm listening to the heart sounds, I'm hearing them, but it's not like I'm doing much. Whereas when I give injections, like, the patient's just got their vitamin B12 and they're, like, happy because they don't have to come back for a little while. Or they've just got their flu or whatever injection that is at that time. So I'm like, oh, that, you know, they feel like they've received something.
Nice. What do you do outside med school?
Outside med school, I love traveling and just seeing places, just coming to share. You know, it's been good to explore the area here. I love eating out, trying new places. As Young would know, we're just planning a Melbourne trip.
Nice.
And we've booked lots of new restaurants to try. We've booked a really good hotel that we've all been excited to try. So outside of med school, I just love traveling, exploring, eating out. I love watching movies, TikTok, shopping, if that counts as a hobby.
Yep, can be a hobby, especially when you stress out.
And just spending time with my family and friends as well.
What advice do you have for your 11, year 12 student that want to pursue a similar journey that you have?
Yeah. So if you're interested in pursuing a similar journey to me, I would highly recommend you start learning for the UCAT pretty early on, just getting a sense of what the questions are like so you're not seeing it for the first time when you go in. And not that it's really systematic, but there is parts of the UCAT that you can train for and improve over time. So definitely getting started on UCAT. And if you're doing my pathway, there is definitely an aspect of community service / being involved in the community and really trying to experience that regional lifestyle, I guess, as well. So any kind of community service, if you're not already involved, I would highly encourage you to get involved in the community. And if you've already been doing that, that's great. And thirdly, just preparing for the interview, and I think preparing for the interview is just preparing yourself as a person, and not so much just for the answers, but just thinking about your strengths, your weaknesses, your qualities that could attribute to being a good doctor. Like, what are some good traits that you see in that you think would be good as a doctor? And yeah, thinking about that, like how empathetic you are, getting a lot of different opinions, seeing a bit of a world view, so you have a bit more of an open mind. So I think if you're trying to prepare for this course, I would definitely suggest more improving yourself. But for the interviews, I reckon just being yourself, really being able to show your personality and who you are and why you want to do it, rather than just thinking about pre-formulated answers. They love to see your individual take on the questions, your individual personality that comes through.
Yeah, interview can be actually quite wild and stuff.
Yeah.
Any last comment?
For preparation for uni, I would say for undergrad, I would definitely recommend learning how to do references and maybe looking into that just before you start uni. So learning how to do like APA 6 reference style, those kind of things. We haven't really had as many assignments in postgrad, but definitely for your undergrad degree. Finding a note-taking system that works for you, whether it's like OneNote, Google Docs, Anki. So just trying to figure out a system that works for you and how you want to approach it. Definitely getting a good sleep routine, a study schedule.
Do you sleep well?
I do now. I still have not mastered the discipline aspect and getting a good study routine. So finding out what's going to work for you. Do you study better at a library? Like, do you study better in your room? Thinking about those things. And yeah, but just trying to enjoy the content and just taking it slow, and definitely having like a work-life balance between your uni and your everyday life is my tip.
If there's a work-life balance in med school?
I believe you can achieve work-life balance in med school.
Do you know somebody who have achieved that?
Me?